Welcome, welcome, welcome. Thank you for spending some of your time with us. My name is Tina Rosenquist, and this is Knowledge for Wellness. And this show is to better inform you, because the more information you have, the better informed decisions you will make. And today with me is Dr. O.J. Rustad and Dr. Ruth Rustad. Welcome so much from Advanced Dermatology.
Thank you.
And you are on the border of Vadnais Heights and White Bear Township, right?
Correct.
On Centerville Road. Well, welcome. That's so delighted that you two could join us.
Well, thank you.
Pleasure.
So this segment, I guess, is going to be actually on skin cancer, which is something that everyone is just very concerned about right now, especially, you know, in this day and age. They're saying tanning booths are bad, you know, a lot of variables. And I'm so glad I have both of you to enhance our viewers. And so I basically want to get a little bit about yourselves, your business, your website. So after this, then they can go ahead and get in touch with the both of you. Dr. O.J., would you like to go ahead?
Sure. I finished my dermatology residency in 1989. I did an extra year of dermatology surgery and then subsequently started advanced dermatology care in 1993 and have been practicing in the Twin Cities area since then.
Oh, great. Okay, and Dr. Ruth?
Well, I finished med school and did my residency in internal medicine and worked for a few years in internal medicine and then joined advanced dermatology care in 2001. Now, with my background as an internal medicine physician, I did a preceptorship in dermatology, and now I only focus my care in dermatology. So, and in 2003, I became the medical director of our cosmetic services as well.
Oh,
so I divide my time between medical and cosmetic dermatology.
Perfect. Wow. And we're going to talk this segment on skin cancer. So I guess basically, you know, you can go ahead and maybe people just aren't even aware of skin cancer. I know there's precancerous cells, things like that, that we kind of talked a little bit about. But one of you want to take it away about skin cancer? I would think that would be you, Dr. Ruth.
Well, skin cancer is the most common cancer diagnosed, and we think of it as kind of two main kinds of skin cancer. There's non-melanoma skin cancer, which includes basal cell carcinomas and squamous cell carcinomas, and of course there's a lot of subtypes within all those. And then the other main division is melanoma. Melanoma is a very aggressive and deadly cancer. The other two are not, although squamous cell carcinomas do have the potential to metastasize, that is to spread locally if they're not caught and they are present for a while. But like all skin cancers, if they're detected early and removed early, there's a good chance of recovery.
Yeah, that's good to know. Yeah. So watch yourselves for the moles, things like that, that, you know, once they do grow, you know, in that respect. So when we're talking about precancerous skin lesions also, you want to embellish a little bit on that too?
Do you want me to take that? Or you?
Sure.
Sure. Okay. Well, one of the huge factors that increase risk is sun damage. And our sun exposure is really an accumulation of our lifetime exposure, not just in the more recent years. People are much more aware and often do come to the clinic and they tell me they have been wearing sunscreen, and I believe them.
Yes.
But I think that the risk is because from when they were a little kid running around, playing outside all the time, tanning as we all did in the 60s and 70s and 80s, and that accumulation of UV exposure has continued to damage the skin. Precancerous lesions are usually accompanied by some other signs of sun exposure. Sun damage or solar elastosis can cause a lot of irregular pigmentation, early wrinkles, some lesions that develop, and it can be a little difficult to sort through all those. What is the precancerous lesion versus just signs of photoaging? There's one type of precancerous lesion is called an actinic keratosis, and that is a kind of a rough, ill-defined red, scaly little patch or little spot, and those have the potential to develop into squamous cell carcinomas. The other kind of precancerous lesion is in the melanoma camp, and those are kind of what we think about as funky-looking moles. Moles that are unusual looking, they're asymmetrically colored, they're not evenly colored from one side to the other. They may have really irregular borders. The colors are kind of suspicious, like real black, like put on with a Sharpie, especially if your other moles are not that color. the bigger they are and the deeper they are, of course, the worse the chances are. And then the last thing we look for is something that is, when we talked about those previous things, I'm going to backtrack a minute because I just kind of briefly describe what we call the ABCDEs of looking at diagnosing a pigmented precancerous lesion or melanoma. A stands for asymmetry of color. B is the irregular borders. C is colors like black. This one has black, white, pink, along with normal brown and tan here, all kind of unusual colors in a mole. D is bigger than a pencil eraser or 6 millimeters. And then E, which is not on here because it stands for evolving. Hard to show a picture of a change.
Yes.
But is it growing? Is it bleeding? Is it tender? Those kind of things.
Yeah, that's great. I know my husband is of fair skin, and of course he didn't have the sunblock back in the day, and they're out playing football and just being kids, and they really didn't have any warning of that. And he right now is on the precancerous on his face, so he's gone through a few little episodes with that. So I'm just really fortunate that now they've kind of evolved, and now our children, we can protect them a little bit better, getting that out. So and I heard that you should get daily sun exposure, thinking of going on to the sunscreen, and our body needs a little bit of sun too to get the vitamin D, but yet at the same time we need to protect our skin. So there seems to be a little bit of a fine line there. And so exactly how can you talk about which of them being true, or where's the fine line on how long you should actually let your skin get a little bit of sun?
Do you want to take this, or should I respond to that? The vitamin D is a very important vitamin that we have, and we're finding more and more reasons that we need to have adequate vitamin D levels. But getting sun exposure is really not the answer, because number one, you can't be out in the sun long enough to get as much vitamin D as we need as adults, and you would be greatly increasing your risk of skin cancer. After the age of 20, we don't effectively synthesize vitamin D from the sunlight in our skin to meet our needs. As a younger than 20, we do. But after that, it starts to drop off. So we're really much better on getting our vitamin D from foods or supplements. There's a lot of fortified breads and cereals and milk and juices, as well as fish with oils like salmon or tuna fish. Those are excellent sources of vitamin D. And of course, you can go to any health foods department and get a vitamin supplementation of vitamin D. We recommend 1,000 international units of vitamin D per day. And really, I don't think most people have that. And that has a lot of impact on other skin diseases as well. But I would really caution people not to go out and say, well, I'm trying to get my vitamin D, because you're really not. All you're really doing is increasing your risk of skin cancer and sun damage. So, well, just off the cuff, in regards to, of course, the sunblock, is there something that we should go out and buy new sunblock every year, or do they really expire? In that sense. And I was just wanting to protect our viewers, maybe throw away that old sunblock, or is there something that you know of that we should just go ahead and do that, or go ahead and keep it from the year before? What are your thoughts on that?
Well, I think most bottles have an expiration date on them. And so if you can go by the expiration date, I think you'll make some wise decisions in that regard. And also, I think a lot of times it's helpful. The most common area we see skin cancer is the face. And if some people want to use a sunscreen from the previous year, maybe use areas that maybe don't get as high a sun exposure, such as the extremities, chest and back, and I'd use the really good stuff on your face and ears and neck, via the chest, the places that we get most of our sun, and the places you'd rather have not things to be removed.